What if I told you that everything you think you know about skincare might be missing the mark? That there are secrets even trained dermatologists often keep close to the chest, not because they don't want you to know, but because these hacks are subtle, overlooked, and often counterintuitive. Hi, everyone. I'm Dr. Sandra Lee, board-certified dermatologist, and today I'm going to share 5 skincare hacks that most dermatologists don't usually talk about. Subscribe my channel now. The first hack is something you might find surprising, but it is one of the most powerful things you can do for your skin, and that's strategic hydration, not just topically, but internally. We've all heard the advice to drink water, but let me be very clear. Not all hydration is created equal. Water alone is not enough if your diet is high in sodium, caffeine, or sugar. These can dehydrate your skin from the inside out. Incorporating water-rich foods like cucumbers, watermelon, oranges, and leafy greens creates a dual approach to hydration. These foods don't just provide water, they deliver antioxidants, minerals, and vitamins that strengthen your skin barrier. Most people think moisturizer alone can replace this, but it can't. Hydration is a systemic issue, and getting it right internally dramatically improves elasticity, reduces fine lines, and even minimizes redness. The second hack is timing your skincare around your circadian rhythm. Your skin isn't just a passive barrier. It's a living organ with cycles just like the rest of your body. At night, your skin undergoes repair, cell turnover increases, collagen production peaks, and your barrier function strengthens. Yet many people apply active ingredients like retinoids or acids without considering when the skin is most receptive. Using retinoids, vitamin C serums, or exfoliating acids in alignment with your body's natural repair window, generally at night, can maximize their effects. Conversely, applying them during the day, especially under UV exposure, can increase irritation and reduce efficacy. Most skincare routines are based on convenience, not biology, which is why people sometimes spend hundreds on products without seeing results. The third hack is layering products correctly, not just using more. People assume that piling on multiple creams, serums, and oils will exponentially increase results. In reality, incorrect layering can neutralize active ingredients or prevent absorption. A common mistake is applying thick moisturizers before serums. This can block penetration. A general rule I recommend is lightest to heaviest, most active to least active. For instance, water-based serums with actives like hyaluronic acid, niacinamide, or peptides should go on first, followed by oil-based treatments, and finally a heavier cream or sunscreen. Even sunscreens can be compromised if layered incorrectly. The actives in some moisturizers can destabilize certain chemical filters. Understanding product compatibility is a subtle yet crucial aspect that's rarely discussed outside of dermatology circles. Hack number 4 is about mechanical stress on your skin. In other words, how you touch, rub, or manipulate your face. Acne, premature lines, and irritation often result from mechanical forces we rarely notice. Constantly rubbing your eyes, resting your chin in your hands, or aggressively scrubbing during cleansing might feel harmless, but these motions can compromise your skin barrier over time. For acne-prone skin, picking or squeezing lesions is obviously a no-no, but even subtle habits like tugging at dry patches or exfoliating with too much force can create micro tears. One trick I share with my patients is to switch to gentle tapping motions when applying products, or using a soft microfiber cloth instead of harsh exfoliating scrubs. Protecting your skin from unnecessary stress reduces inflammation, supports natural healing, and ultimately maintains a more even tone. The fifth hack is something people often completely overlook: the role of your gut and diet in skin health. While dermatologists frequently discuss topical treatments, the gut-skin connection is profound and underappreciated. Emerging studies show that an imbalance in gut bacteria can trigger inflammation, worsen acne, and accelerate aging. Including probiotic-rich foods like yogurt, kefir, kimchi, and miso, along with prebiotic fibers from onions, garlic, and bananas, can create a healthier microbiome. This doesn't replace topical treatments, but it enhances their effectiveness. Similarly, limiting inflammatory foods such as highly processed sugars and refined carbohydrates can reduce systemic inflammation, which directly impacts redness, acne flares, and eczema. Most skincare conversations focus on creams and serums, but the inside-out approach is often what makes the most dramatic difference. Now, let's talk about the overarching principle connecting all these hacks: consistency over complexity. Skincare is not about using the most expensive serum or the latest trendy mask. It's about understanding your skin, treating it gently, and supporting it from the inside and out. Overcomplicating your routine can create irritation, financial stress, and frustration, which ironically contributes to more skin problems. A simple, consistent routine that respects your biology, hydration, proper timing, correct layering, minimal mechanical stress, and diet optimization is more effective than any flashy treatment. Another underrated point that most people ignore is UV protection in unconventional forms. Sunscreen is non-negotiable, but there are daily habits that multiply its effects. Wearing wide-brimmed hats, using sunglasses that shield the delicate under-eye area, and even adjusting your commute to avoid peak sun hours can prevent cumulative UV damage. UV exposure is not just about burns, it drives collagen breakdown, hyperpigmentation, and uneven texture. People often forget that everyday incidental exposure, walking to the car, running errands, or sitting near windows, contributes to long-term damage. These small cumulative decisions often have more impact than one dramatic sunburn or over-the-top sunscreen application. Let's also touch on a lesser-known secret in the anti-aging world of thermal modulation. You might have noticed spa treatments that use alternating hot and cold, or people applying ice to reduce puffiness. There's science behind it. Gentle thermal stress can stimulate circulation, improve lymphatic drainage, and support collagen formation. Even simple practices like ending your shower with a cold rinse or alternating warm compresses on problem areas can subtly improve skin tone and elasticity. This is often overlooked because it doesn't involve fancy products, yet it's rooted in dermatologic principles. Now, one thing I cannot stress enough is the danger of over-exfoliation. Everyone wants smooth skin, glowing skin, and acne-free skin, but too many chemical peels, scrubs, or harsh acids actually backfire. Over-exfoliation disrupts your barrier, leading to increased sensitivity, dryness, and breakouts. I often see patients who spend hundreds on exfoliating acids only to worsen their condition. The key is moderation and understanding your skin type. Sensitive skin needs gentle, minimal exfoliation, while oily or resilient skin may tolerate more frequent treatments. Less is often more, and patience pays off more than aggressive routines. Another dermatology hack that's underutilized is monitoring your skin's microbiome with gentle, non-stripping cleansers. Harsh soaps and cleansers that claim to remove all oils actually strip away protective lipids and friendly bacteria. Maintaining this balance prevents acne, eczema flares, and dryness. Mild pH balance cleansers are often overlooked because they don't give the immediate tight, clean sensation, but they protect the skin barrier over months and years. Think of it like tending a garden. You don't want to wash away the nutrients along with the weeds. Lastly, let's talk about sleep and stress, because these are true dermatology hacks that are free but underappreciated. Cortisol, the stress hormone, directly affects oil production, inflammation, and even collagen breakdown. Poor sleep or chronic stress can exacerbate acne, rosacea, and fine lines. Most skincare advice focuses on creams, masks, and serums, but the internal environment of your body plays a dominant role. Prioritizing 7 to 9 hours of quality sleep, managing stress through meditation, movement, or mindfulness, and maintaining consistent routines can amplify all other skincare efforts. Even the most expensive retinoid won't compensate for chronic stress and sleepless nights. So there you have it. 5 key skincare hacks that dermatologists often don't share, along with some complementary insights that will completely change how you approach your skin. Remember, this isn't about chasing trends or splurging on luxury products. It's about understanding biology, respecting your skin, and applying evidence-based practices consistently. Hydrate internally and externally, align treatments with your body's natural cycles, layer products strategically, minimize mechanical stress, nourish your gut, protect against UV, moderate exfoliation, maintain your microbiome, and prioritize sleep and stress management. These are subtle but powerful shifts that can make a lifelong difference. And here's the most important part. Start small. You don't need to change everything at once. Pick one of these hacks, implement it consistently for a few weeks, observe the difference, and layer on another. Skin transformation is a journey, not an overnight miracle. Treat it with care, knowledge, and patience, and you will see results that no flashy ad or expensive serum can guarantee. If you are new here, hit that subscribe button and turn on notifications, because every single week I share dermatology insights, practical skin tips, and science-backed strategies to help you achieve your healthiest, clearest skin. Trust me, your skin is worth it.